Colon cancer screening is a very important topic. We all are aware that age 50 and over should be screened for colon cancer, but what some people may not be aware of is that age 45 is now the recommended target for screening for colon cancer based off 3 societies: the American Cancer Society, American College of Gastroenterology, and the United States Preventative Task Force. And the reason this recommendation was changed is because a recent study showed that advanced polyps, which are high-risk polyps, were found equally when they looked at ages 45 to 50 compared to 50 to 55-year-olds. So starting at age 45, even in asymptomatic patients, we should be talking about colon cancer screening. And that's done through 2 different ways. Largely colon cancer prevention test, which colonoscopy is considered the gold standard for prevention, and colon cancer detection tests, such as the stool for blood or stool for DNA. Both fulfill colon cancer screening, but it depends on what the patient is valuing. Do they want a prevention test, such as colonoscopy, or do they want more of a detection test, which is the stool for blood? Then the other things to consider is if you're going down the colonoscopy route and you want a prevention test, looking at quality metrics is important because that defines how well your colonoscopy will protect you from colon cancer in the future. The gold standard for quality in colonoscopy currently is the adenoma detection rate. So this rate is looking at how often does the provider that does your colonoscopy finding precancerous polyps. We know that when we look at both males and females, that rate should be above 25%. Every 1% gain over that 25% is a reduction in developing a colon cancer by 3% from your next colonoscopy, and a 5% reduction in a deadly colon cancer occurring before your next colonoscopy. So knowing the adenoma detection rate of your provider is very important. A lot goes into how often do we find polyps. It's how fast do we come back when we reach the end of the colon. Are we pulling back the folds? Because in the colon there are a lot of folds and there are a lot of turns. Not only that, but the preparation, which is key for the patient standpoint, also allows us to detect polyps. If the prep is not good, large flat polyps can easily be missed because the prep would not come off or the stool would not come off the lining of the colon. So all that feeds into the adenoma detection rate, which again is the key quality metric in colonoscopy.